Hello, good afternoon. My name is Steven Marabong and my mentor, Miss Monique Lighton. I will be interviewing her about the different procedures in the district when it comes to accepting students with their in the testing areas, and also regarding how what's the process. Okay, so be with us. All right. All right. My first question, Ms. Lighton, is what will the parents do if they suspect that their child needs special education services? Usually.
And that's a great first question. What they do is they go through the counselor, the school counselor,
Counselor.
and they fill out a referral packet. Normally, the referral packet will ask questions about medical history, educational history, if they're taking any medications, we ask that. We also ask family history, so has anybody else in the family had dyslexia or any type of learning disability? And if so, were they receiving any type of services? So we go in depth and we try to figure out as much as we can about the child through that parent referral. But they also meet for a meeting. They have a meeting, and it's a referral meeting. They go over what the qualifications are and if the child does qualify, if the child doesn't. So they have a meeting with the administrators, the counselors, and the child's teacher as well.
Okay. So who's the parents meeting with?
They're meeting with
The counselor, right?
the counselor. They also meet with the principal or the assistant principal. They also meet with the child's teacher,
Teacher.
and they move on from there.
Oh,
They
okay.
discuss their concerns.
That's good. I see.
Sometimes the teachers have already seen that there may be an issue, or sometimes the parent can request at any time, whether the grades are good or not, or whether they have been through the complete RTI process, it doesn't matter.
Doesn't matter.
They can refer at any time.
Okay, I think that's in connection to the second question. Is there a need for the student to undergo an RTI before he or she will be scheduled for testing? I think you just have answered that. So there's no need for RTI.
Nope. If we suspect, we want to test as soon as possible. We don't want to wait for the child to fail. We want to test immediately if we get the consent, of course.
But do the district encourage the teachers and the parents to have their kids RTI first, or they don't? They say it doesn't matter, or they encourage.
Well, the kids who are not doing well, they are in RTI as of when they notice that there is a deficit.
Okay.
But we now this year, especially this year, we have a don't wait policy. So if you suspect, then we get that paperwork ready, and we talk to the parent through the meeting and let the parent know that the teachers have concerns or the admin has concerns.
Oh, okay. All right. Now the next one is what can a teacher do if he or she suspects? I think you have discussed it a little bit, but what can a teacher do if he or she suspects that one of the student has special needs? If let's say, you know what, this kid might have something, and we need to look at it. What can they do?
They can also request that a child be tested, but of course they have to get consent from the parent
Oh,
too.
okay,
So
consent.
the parent can always say, I don't think my child needs to be tested, and I'm not going to give consent to the school. But most times parents do give consent because they are concerned as well,
Yes.
or they want the best for their child academically. And so we normally don't have too many issues with parents agreeing to test.
Okay. So the first, the teacher suspects that there was something wrong with the child, so she goes to the parents to have a concern, or does she talk to the counselor maybe
Yes.
first?
Mhm.
So and then discuss, and then later on maybe they agreed and ask the parents.
Yes, she can go to the counselor, she or he can go to the counselor, discuss the concerns, and the counselor can call a meeting as well. Or sometimes we know teachers have that one-on-one with the parent. They have that relationship. They built that rapport. So they may just, have a parent-teacher conference, bring up their concerns, bring up the special ed process. We make sure all of our teachers are fully aware of how to talk to parents about those concerns in a way that doesn't overwhelm them.
But that talking to the counselor is not again. It's not necessary. If the teacher can just go speak to the teacher.
Well, the counselor has a referral packet, so she would be the gateway to getting the process started. But sometimes we want to gently allow the parent the news first, and then
work from there.
Because sometimes the teachers are the first, the best option to talk to the parents about their concerns, of course.
That's good. Okay. All right. If the student did not qualify in special ed, that's after testing, does the district allow the parents to request for retesting if they want to? Let's say the parents, oh, you know what, I don't agree with your result. I want some retest. Is that, what's the policy of the district on that?
They can ask for an independent evaluation, an IEE. And that's through a third party that is not through the school district at all.
So it's no longer the school, like let's say our diagnostician, they are not the one who will retest. It's somebody else outside the school.
It's someone else outside the school, someone we don't contract with. They'll come in and test the kid, and then they'll give their data to the diagnostician, and we'll go over it in an ARD. We don't have that happen too often, and a lot of times there are other options if the child doesn't qualify. So the child may not qualify, but we may be able to put them on the 504 list or get them some other intervention help.
RTI and
yes, RTI and all of that good stuff.
All right. So thank you. Do we qualify the students in special ed even if their psychological assessment is within average or above range if they are failing their class in their class? Let's say they're okay. Maybe they're below a little below average, but then psychologically they're good, but they're failing. What is our stand, our districts?
Well, overall, you have to remember once the FIE is completed, once the evaluation is completed, it is still an ARD committee decision over how we move forward. So the ARD committee may disagree with the findings, or they may feel that special ed services can still be beneficial to the child. So when, as a diagnostician, what we look at is we don't just look at our FIE, because that's just one source of data. What we look at is the FIE, we look at the grades, we look at the classroom observation, we look at any curriculum-based assessments that they may have taken for the 6 weeks or the 9 weeks, and then we make a judgment as a committee. And so most times, there's been maybe about 2 instances this school year where the child didn't qualify, but we did put the child in due to a continuing regression.
What if though, this is actually my question, what if the problem is actually caused by behavior? It has, let's say, absences, and maybe that might be a separate, or maybe a behavior related, and we know that because that's a realistic experience that we have kids who are really, there's really nothing wrong. He's with him psychologically. The only thing is the kid doesn't want to do his work. The kid doesn't want to do anything. Doesn't want to follow instruction. Doesn't give assignments. Doesn't those kind of failures. Can we still? Are they still be put in the special ed program?
Yes, they are. Once again, it's like an ARD committee decision. But we do like to pass those cases on to our school psychologists So the diagnostician does her testing or does his testing first, and once we finish our reports, we pass our reports to the school psychologist.
For this interruption, I need all car riders to the back of the building at this time, please. I need all car riders to the back of the building at
It's
this
still
time,
working.
please. It is now time to dismiss all car riders to the back of the
Sorry
building.
about that.
Thank you.
Okay, go ahead.
And so once we pass it on to the school psychologist, she looks and she does a classroom observation. She normally does the GARS or the BAS. We do adaptive behavior scales as well, just to determine if the child has a behavior issue and how we can deal with it in the classroom. But we have our special ed teachers write behavior goals as well. So
Yeah.
sometimes a student may come in just to work with behavior, and we don't have a lot of experts on staff, but we do have some students who receive help from the special ed counselor, or we may get outside sources that are not with special ed, like the social worker, to come see the child in order for the child to grow and be successful with assistance. So.
That's good, thank you. I think this will be the last one. How does the district deal with the children in special education who is extremely disruptive in the regular class? So let's say, okay, he is specifically in content mastery area, or even not in content mastery, or maybe resource. What if the kid is extremely disruptive, but intellectually, yeah, struggling, but it's more on the behavior. What's the last resort if, let's say, we do our behavior plan, behavior intervention plan, but in spite of that, it's still not successful, and what he does, the student does, is just ruin the classroom. It's like it's trying to prevent other kids from learning from the teacher. So what is our last resort of that?
Well, what we do is we have a behavior unit for students who disrupt, but that is a more restrictive environment. So we want to go through all our processes of documentation. First, we get the school psychologist to do a functional behavior assessment, and then from there she develops a BIP based on their diagnosis. If they've already been diagnosed with behavior issue or behavior disability, then from there we go to ARD, we review the BIP, we accept the BIP, we try the BIP, see if it works for the child. Sometimes it does work and their behavior gets better, especially when they know that they're being monitored. And we do have the children sign that contract saying that from here on out, we're watching, we want you to do better, we've got these positive reinforcements in place, so let's see what you can do to earn these positive reinforcers. So we do have a behavior unit, but that is a more restrictive environment, so we don't, that is like the last option for the student. But in the behavior unit, they're serviced by a special ed teacher who has learned certain skills, positive behavior skills, also ABA skills to function and work with that behavior and help the child cope. So sometimes that is the best placement for them, but we just have to go through the process.
Right. But once the kid, the student is in the behavior unit, can they come back to the regular class?
Oh, definitely. We monitor there too, and they have annual ARDs and they have review ARDs there as well. So if the child is doing well, then we as a committee come together and we make that decision. But we definitely have kids who are there for a short stay. Some who don't do better, they stay for the next school year, but they normally get reviewed. So we keep our data, let the parents know, we send home notes letting them know that they're doing well, they're getting better, and we also work with the parents on how to work with them at home. So the parents kind of have some homework to develop and help them cope.
That's good. There's coordination between the school and home.
Definitely.
Yeah. What if the parents, though, okay, her kid is in the behavior unit, and then, whether the parent decides, you know what, I'm pulling him out or her out from the ABU, I need to put him in a regular classroom. Is there is it within his or her right to do so?
Oh, definitely. We've had instances where parents just didn't feel like the unit was the right place for their child, or life skills was the right place, or they didn't agree with the art committee. We could have went to due process, but a lot of times we've actually had a few instances in the district where parents will revoke consent for services, which just means they no longer want their child in special education. And we try at the art to work with those parents and to develop other solutions besides revoking consent. So whether it's less restrictive environment, we try to work with those parents because we want to make sure that the child gets the help that they need. But we understand that at the end of the day, the parents have the right.
Yeah, that's right. Miss Lighton, you're awesome. Thank you so
Thank
much.
you.
Miss Lighton, thank you.
Thank you.
All right.
All righty.